All right, so welcome to my Zoom talk. I'm Dr. Jerry Preston, a wellness advocate for doTERRA essential oils. Tonight I'm going to be talking about the topic of essential oil use, safe and effective use for pregnancy, nursing, and for infants. So I'm going to be pulling up a PowerPoint. I'll be taking it up and down to be talking to you. I'll be sharing some of the oils I actually have here and talking about how they actually smell and showing you ways you can use it. And then I'll be referencing another document that I can send to you as a PDF if you're interested. So there's a comment bar on Zoom if you've never used it. You can also raise your hand. There's option to raise your hand, or you can reach out to me after the fact. I'll have a few minutes after I talk to answer any questions as well. So let's get started. I'm going to share this document with you. Make this bigger. All right, so here we go. Like I mentioned, the topic is on pregnancy, nursing with, and using essential oils with infants. And I'm a naturopathic doctor. Oops. Here's when this turning. There. So just a little bit of the history. These are my kiddos. So the reason I got involved with essential oils was because of my kids. I did not use essential oils while I was pregnant because I did not know much about them. I also was considered a high-risk pregnancy, so I'll get into details about, when you should and should not use oils in pregnancy. And having a high-risk pregnancy, I was cautious with a lot of things that I did. So even if I would have known everything about essential oils, I'm not sure if I would have used them during my pregnancy. But I did start using essential oils when they were about a year old, and that's because they weren't sleeping through the night. So had tried everything. I was getting no sleep. They were getting no sleep. My husband was getting no sleep. So I had a friend in school that was heavily involved with doTERRA, and she started, saying, maybe you should use this oil. And so I started with cedarwood. And cedarwood is a woodsy oil. It smells really good. It's calming. Some people, it really helps them sleep. It has a very masculine scent to it. So I use this with my kids and didn't do anything. So the next one she said to use, or that I was like, maybe let's try lavender. Lavender works great for me. Use lavender the first night. They slept through the night. So I was like, I don't know. Maybe it's just a fluke. Tried it again. They slept through the night. And that was basically it for me. I was like, I need to know more. I want to use these more. And my kids have been using essential oil since then. It's been about 2.5 years now. We just now stopped diffusing in their room every night. So it's been an amazing journey for us using essential oils, and I've found that they've helped in so many aspects of my health and their health and my husband's health. So we really are in love with our essential oils. So the objectives for today are talk about the safe use of essential oils in pregnancy, what specific oils you can use, and the oils you should avoid. And then we'll go into breastfeeding, the do's and don'ts of oils of that, and then babies, like when you can use them, starting at what age, how you use them with babies. And I'm talking like topically, aromatically, things like that. And then I'll talk a little bit about kids as extra bonus. So pregnancy. Now, I think this is like a hot topic because people don't really understand how essential oils work, and they also don't understand that the type of oil or the brand and the quality of the oil is just as important. So you really need to look at it from an individualized perspective, just like anything you are to put on your skin, take internally, or use in your household, because everything we're exposed to gets inside of our system one way or another. So if you are someone who has had difficult past pregnancies, you need to take that into consideration. If you have pre-existing health conditions like high blood pressure during pregnancy, if you're on medications during pregnancy, or you are just someone that is sensitive to just things, you know, sensitive to perfume, sensitive to different foods, sensitive to, you know, environmental factors, or you have allergies or something like that. All of that is something that you should take into consideration when starting any type of therapy or natural remedy, because although these are generally safe and effective, it is still a medical application or a medical health and wellness remedy. It's not a prescription, but just because it is natural doesn't mean that it is 100% safe for every individual, since you know everyone reacts differently to things. So keeping that in mind when using essential oils in pregnancy is key. And then the trimester you're in is really important as well. So you have to start slow and then work your way up. So you probably already know, if you're pregnant or you've been pregnant, the first trimester is the most vital period that the fetus is growing. So many things are developing in the first trimester. The nervous system is developing, the heart, the brain, all of these things and all of these cells are trying to form to create this human. So the first trimester is vital, and you want to be cautious with anything you add into your body at that point. So I'm going to talk about like what's the safest way to use essential oils in the first trimester, and then you can kind of work up from there. And then, as with anything that you add new to your health regimen, always consult with your healthcare practitioner, your midwife, your OBGYN, and even if they don't know a lot about essential oils, you can bring information to them and say, hey, I learned about this. This company is really great. They are highly studied. There's no synthetics or additives in their products, which I'm speaking about doTERRA. And bring that information to them and show them like, hey, I'm interested in this and I've done a little bit of research on it. What do you think about it? And just, you know, if they say, no, I don't know anything about that, I don't think you should do it, you can take that into consideration and also go with your intuition and your gut feeling, because typically you're on point when it comes with that. So let's go over what the oils that are considered safe during pregnancy, and then we'll talk about the ones to avoid. So the ones I have highlighted under the safe, or darkened, I should say, lavender and lang-a-lang. And the reason I have those darkened is because they are the most commonly used, and I think overall for complications that people have with pregnancy, whether it's nausea, back pain, feet swelling, restlessness, hard time sleeping, these are the two that will address the most things. So that's why I darken them. But other ones that are safe are, Roman chamomile, bergamot, lemon, wild orange, geranium, grapefruit, ginger, helichrysum, and frankincense. And there are so many different ways you can use these oils, or so many different ailments in which you can use them, that I'm going to talk about that just a little bit. So, for example, lang-a-lang is great for bedtime routine or putting into Epsom salts to do a bath soak. Lemon is great for like energizing. You know, there's a lot of fatigue that can happen around pregnancy because you're growing a human and your energy might be low. So lemon and wild orange are actually both really great for that. And then ginger and grapefruit are great for nausea. Helichrysum and frankincense are both great for inflammation. So towards the end of pregnancy, when there's a lot of swelling going on, or with stretch marks, you can use it actually over the stretch marks in the abdomen to help reduce the appearance of that. So now I think is a good time to talk about this resource. So let me stop screen share. I don't know if you can see me, but this resource is key. It's called the Smart Mom's Guide to Essential Oils. You can get it at Barnes & Noble. You can get it on Amazon, relatively inexpensive book. Let me see. Okay, sorry, I thought I had a comment. But it talks about in here the ways you can use the oils. So let me escape this, sorry. And it talks about like how you would make a balm to use for stretch marks. And it talks even specifically on the trimesters and how you should use them, like what's safe for first trimester, what's good for second trimester. And it has this avoid and safe list, like I talked about. So it's a really great resource, in my opinion, and I've used it a ton. You can also use oils during labor and delivery. So I'm going to talk about that because on here I have, this oil is not safe, but there are times when it is safe. So let me start back with slideshow. It's kind of hard to go back and forth on here because you have to go to full screen. Okay, so to go into the oils we should avoid, and then I'll go back to, some of those that are okay during like these asterisk ones. So ones you should avoid are basil, black pepper, camphor, cinnamon, cassia, which cassia is very similar to cinnamon, clary, sage, clove, fir, jasmine, juniper, marjoram, myrrh, oregano, rosemary, and thyme. I know it says safe. This was to say sage. Sorry. And the asterisk means basically, although those are oils you should avoid during pregnancy, they can actually be beneficial oils during labor and delivery or to stimulate. If you're like, 41 weeks and you just want that baby out, clary sage actually might be an oil that could help you stimulate labor and delivery. So those are oils that you should always consult with a healthcare practitioner on how to safely do that and not mess around with that on your own unless you are trained and you really understand essential oil use. And the reason I should mention that a lot of these you have to avoid is because the chemical constituent of them can interact with development of the fetus. It can stimulate labor. It can just aggravate the fetus. It can aggravate you. So it's just from the research, it's showing that these are just oils that you should not use during pregnancy. So the different ways, the safe ways to use essential oils. The first one is through inhalation, and I have this marked. This is the way you should use oils during the first trimester because it's least invasive. If you're to have a reaction to it, you can obviously get the oil out of your hand, go into the other room, take deep breaths. And inhaling is different than diffusing. So inhaling would just be simply, I don't know if you can see me, honestly. So I'm going to stop this, and then you can just see me. So inhaling would just be taking the bottle of oil, taking a deep breath in. And if you're nauseous, ginger, you can do that even with ginger to help with nausea. You don't have to put it on topically or ingest it to help it to have the effects that it's supposed to have as an anti-nausea. So you can just take a whiff and then put it down. And you can do that a couple times. You don't need to just hold the bottle up to your nose. It's a little too much, but just a whiff here and there. And that is really the most safe way to use it in the first trimester. Once you start moving on to the second trimester and you're kind of out of that zone where things are changing so much and there's so much growth and crucial time and development going on, you can then move on to diffusing. So diffusing is similar to the inhalation, but it's constant release of the oil. So I actually don't have my diffuser by me. I usually always have it right by me, or in my office at least. But I was teaching a class the other day and I packed that one away. So diffusing, you probably know what a diffuser is. So you mix water and a couple drops of oil. With doTERRA oils, I usually say no more than 4 drops. For pregnancy, I would probably say 2 or 3. So you could do lavender diffusing, and that way, it's helping with the smell of the room. If you have really bad nausea or a headache, you can mix lavender for the headache, ginger for the nausea, and kind of make a blend of oils that can help address your overall discomforts. And because it's more of a constant diffusing and you're constantly inhaling that, whatever room you're in, that's second trimester is where you can really start exploring that. And then in third trimester, you can do both of those, inhale and diffusing, and then you can start experimenting with topical applications. So always with topical, you want to dilute, no matter what, even if you're not pregnant, especially with infants and with kids. So topical dilution is just using a carrier oil, which I don't have that by me, but fractionated coconut oil is a carrier oil, jojoba, almond oil, and just pour some into your hand, maybe like half a teaspoon. Put 1 drop of the oil, so 1 drop of lavender with the carrier oil, rub it together, rub it on the back of your neck, the bottom of your feet. If you're trying to prevent stretch marks or the appearance, you can rub it right on your belly. If you're doing it on your belly because that's closer exposure to the baby, I would say even like more carrier oil and less essential oil. So like a half a drop, if you can get a half a drop out. You can do a technique where you put a toothpick in here, so you're just getting a little bit, and then you can like mix that into your hand with the carrier oil. You can make a roller bottle. So if you get an empty roller bottle, you fill this up with carrier oil, and then you would just do like 2 drops of a essential oil, and that way you'll always have that around. Like the frankincense and the helichrysum, you can mix 1 drop of each with the carrier oil in a roller bottle, and that could be your stretch mark reducer blend. So I hope that makes sense. Just always start with the least invasive way early on, and then you can kind of build up that. And also you can see like if you're sensitive to something, some people are really sensitive to lavender, and some people love lavender and they don't have any issues with it, but everyone's a little bit different. All right, so I'm going to move right into breastfeeding. If there's any questions, you can ask me at the end regarding pregnancy, but I don't want to run out of time. So breastfeeding, the do's and don'ts. So aromatherapy, which is diffusing, is fine in breastfeeding unless you find out the baby is sensitive. I would do it in an open space if the baby's super young. But aromatherapy is great for emotional support. Like if you're going through the baby blues, postpartum, possible postpartum depression, like aromatherapy can really help with mood. Diluting topically, like I talked about in pregnancy, you can continue on with breastfeeding. I would not put right over the breast tissue because if you're nursing, that might aggravate the baby. Caution with area of application, like I was just mentioning, so not over the breast tissue or anything that the baby's gonna like be in contact with. So if the baby's on your shoulder and you're wearing a tank top, or even with clothes, because their face is right there, don't put any essential oils on your shoulder or your neck, because then their face is always right in that area. And then you can use essential oils to help with milk production. So you always want to use diluted. So you can use clary sage on the breast when the baby's not going to be nursing. So say you nurse the baby, and then as soon as they're done, you can do it, because, you know, like depending on what type of nurser you have, if you have like an every 20-minute nurser, then you might not be able to do this. But if your baby doesn't nurse for another 2 hours, then you can put it on there, because by the time they nurse again, there's not going to be anything left on the skin. Fennel you can use to help with milk production, but you also see that I have fennel on the don't list. And the only reason for that is that that can actually be aggravating if used for too long. So fennel you can use for about max 10 days. If you use fennel too long, it can cause like urinary tract infections or urinary tract discomfort. And you caution with fennel, because some kids or some babies are actually aggravated by fennel. It can help milk production, but if the baby doesn't like the taste of the milk and they're not nursing as much because the fennel change the taste of the milk, then that can affect milk production by them not nursing as much. Basil can also help with milk production. So mastitis, which is inflammation of the breast tissue, and it's very painful. I never had to deal with it during my 27 months of nursing, but I know people that have had, and I've heard it's horrible and uncomfortable, and it can be excruciating. But lavender, warm lavender compress, so just a warm cloth with lavender on it over the breast tissue, is really calming and soothing and rejuvenating. And then onto the don't list. So you don't want to be taking things internally unless you're doing it to help with milk production, and you're very cautious and you're working with someone that understands that. And then other oils you should not use. Peppermint is the main one, because it's aggravating. Babies will stop nursing because it changes the taste of the milk, and babies in general don't do great with peppermint. So they do at a certain age, I think they do fine with peppermint when it comes to fevers and stuff, but it's a strong oil taste-wise, and they don't like it in their milk. Peppermint's actually used to stop milk production, to dry up the milk, and it's used in it as an aversion to so babies don't want the milk. So it's definitely one you want to avoid if you want to have a successful breastfeeding journey. All right, so that was pretty quick through breastfeeding. There's, like I said, great information in this book. And I did want to share with you this other document that I like to use when it comes to breastfeeding and babies and nursing. Let's see. And this is one I can send to whoever is interested. So I named some of the oils that I've already talked about that are safe during these stages. On the right side, it's talking about breast tenderness, and I was talking about the mastitis. Lavender is great for that. Anxiety, which is something that I think a lot of new parents have because you have this new life that's in your hands that you're responsible for. And swelling, I think, is huge at the end of a pregnancy. Lavender is great for that. Ginger, lemon. Fatigue, which is very common throughout pregnancy and with a newborn. So just inhaling the orange is what I was talking about, just sniffing it is a great way to do that. Hemorrhoids are a common thing that happen with delivery and even before delivery. And yeah, sadness. So bergamot I didn't talk a lot about, but bergamot is a great oil for emotional wellness and emotional mental health. Geranium, frankincense. Frankincense is the king of oils. If you don't know which oil to use frankincense. And then this talks about the stretch mark prevention, which this is where the recipe is. It's right here on the right, this belly butter recipe. Shea butter, cocoa butter. Patchouli I don't have on my list, but that is a safe one for topical use. I would say more so after, and sandalwood more so after pregnancy. Yeah, but this is a great document. So if anyone needs this, let me know. Talks about ways to use it for mastitis, cracked nipples, fussiness, milk supply. Yeah. And then for babies, so I'm going to go into a little bit about using oils for babies. And the key thing for babies is their age and the dilution. So for babies, you don't want to start using essential oils until they're at least 3 months old. So the reason for that is that they're so brand new, and although essential oils are natural, or doTERRA oils are natural, their little immune systems are brand new, and you don't want to be exposing them to really anything, even natural products. You're just wanting them to get good nutrition, good sleep, peaceful environments, and allow their bodies to grow. So 3 months is considered the generally regarded as safe, or the GRAS. And the chart below is saying that these are generally the ages that are regarded as safe and how much oil you can actually use during those ages. So for example, ages 3 to 6 months, you want to use a 1%. And this is all for topical use, never any internal use. I don't even recommend internal use until kids are fully mature, and that can be like older teenage years or young adult years. So for 3 to 6 months, 1% dilution, which is a 10 ml, considering a 10 ml roller bottle. So you would fill it up pretty much to the top with a carrier oil, and then do 2 drops of the oil that you're using. And then it goes down for the other ages, as you can see. So the older they get, the more drops you can use with the same amount of carrier oil. So how you would use them topically, like I mentioned, diffusing. So we started using diffusing with my kids at around a year, and no internal consumption. So diffusing, the way I tell people to start off with diffusing with kids is I wait until they're at least about 6 months before I diffuse around a kid. If it's an open space, like you're diffusing in your living room that has entries into the kitchen and the dining room, it's an open concept, You can start diffusing maybe sooner than that, but you want to make sure that there's ventilation and the kid's not reacting, and do one oil at a time. Do those like safer oils that are lavender or ylang-ylang, the ones that were safe for you in pregnancy. Those are generally regarded as safe for the younger kids too. You never would just want to put a diffuser in a kid's room at like 3 months old, close the door and have it going through the night, because you're in a confined space and they have never been exposed to it before. So start off in an open space, start off with one oil at a time, work your way up and out. For topical application, this is much more information on how you would dilute in this graph over here. And then for using it on them, I always recommend a test spot. So find 2 areas and use a single oil, so like just lavender, and you're going to do it on the bottom of their feet. You know, you did it on the bottom of their feet, then they had no reactions. The next day, you're like, okay, I'm going to do it down their spine. And if they had no reactions that time, then you're generally safe to use that oil. After you've done a single oil and maybe you're like, oh, well, lavender didn't really do it for us, like I want to try ylang-ylang. Then try ylang-ylang separately, and then once you see ylang-ylangs worked and both of them work, you can combine ylang-ylang and lavender. So you want to start slow and see what really works for your kid, and not overdo it by just throwing all these oils together, because if they were to have a reaction, you don't know which oil is causing that reaction. And then there's a difference between using oils directly on an area versus surrounding. So say your kid got a bump or bruise, or your infant. Sometimes it's okay to put it directly on things, and other times you want to put it around the area depending on what is actually going on. And then this chart is just talking about hot oils versus cooling oils. Hot meaning that hot means like they're potent and powerful and you should use them with caution. Cooling is just cooling, like you get a cooling sensation from these oils, and they should also be used with caution. And the ones that are red asterisks you really want to avoid, because they have menthol and monoterpene ketones, which is a chemical constituent of the oil and can be really aggravating for little bodies. Peppermint is a big one that's aggravating. It's a cooling one, but it can also be great in like a little bit older kids that are dealing with asthma or allergies or upper respiratory issues. Same with eucalyptus. Eucalyptus, I like to remind parents, just like Vicks Vapor, like you're never going to rub eucalyptus on their chest until after 2 years old. The same, keep in mind the Vicks Vapor rub limitations when you're talking about these cooling oils. So the top 10 oils for kids, this includes infants, I would say, but you know, you're going into toddler and child adolescence years. Lavender, Roman chamomile, lemon, frankincense, melaleuca. Melaleuca is great as antifungal. So if you have kids that play sports, this is a great oil to use in their cleats for soccer and cleaning their hockey equipment. Wild orange is great for energy. It's invigorating. Cypress, I've had one customer that swears by cypress for bedwetting, so it's a great oil for kids that are wetting the bed. Geranium, ginger, and ylang-ylang. So as you can see, the list is pretty similar to the pregnancy list. So the big issue with essential oil use, I find, is the fear behind it. People are fearful of like what they don't know, and fearful of what they've heard that might not be correct information. So my role as a doTERRA essential oil educator is to help dispel that fear, because what is fear? Fear is false evidence appearing real. So things you might have heard may have been true, or they may not have been true, or they just might be information that's not pertinent to therapeutic grade oils. So yes, people can have negative reactions to oils because every individual is an individual and their body reacts differently. But the big issue with unsafe use of essential oils is getting bad quality oils. So oils that you can get at the convenience store that are laced with synthetics and fragrances, and they're not pure. They have a bunch of additives in it when they actually get tested. So getting a great quality oil such as doTERRA's that's gone through in-house and third-party testing, it's been studied. You can actually see the specs on it. So every bottle of oil of doTERRA's has a little batch number, and I can actually go to a website called source2.com, and I can see the chemical makeup of this oil and see the testing that was done on it and see that, yes, it's only lavender, pure lavender in this bottle and no other synthetic chemicals and additives. So education is really huge for me, and I think that's the biggest factor when feeling comfortable in using essential oils during pregnancy and nursing and with infants. And then just sharing the oils. So if there's any oil you want to try, I always highly encourage people to sample things. So I could send you a sample of lavender for your pregnancy, or frankincense for the prevention of stretch marks. I always want people to feel comfortable using essential oils before they purchase, because it is an investment. It's an investment in your knowledge, so you do have to learn a little bit about it. It's an investment financially. So I want people to feel comfortable with using them. And then empowering parents. Like, this is a toolbox you can have on your shelf in your medicine cabinet, rather than going for, the Tylenol or the Vicks Vapor Rub. You can be pulling out your eucalyptus, or like when the child's older, peppermint for fever reduction, or nausea. You can be using ginger or lavender to calm down any like tantrums or meltdowns your child is having. It's such a great, effective and natural toolbox to have at your fingertips, that you don't feel like you need to run to the convenience store or the drugstore to get Benadryl for an allergy reaction your child is having. So I've found that essential oils are so empowering for parents to have in their toolbox. So that's what I was kind of talking about, how oils can do that. They're accessible, they're powerful yet gentle, and they're so versatile. So all these oils I've talked about, I use them in other ways other than just for health. I use certain oils for cleaning. I love lemon for cleaning. I use oils in cooking. I put some, before I started this talk, I put some wild orange in my water. Um, what else? Frankincense I've used for inflammation topically. Helichrysum I've used for bumps and bruises on myself. I've used it in perfumes. So there's so many ways, and the versatility of essential oils is what keeps me coming back to using them and buying more. So the last point I'm going to make, I'm running out of time definitely, is that having a first aid kit, like I said, your medicine cabinet being stocked with essential oils is great. So I would definitely, in my first aid kit, I would have lavender, I would have On Guard, which I didn't get to talk about On Guard, but On Guard is the protective blend. It's like a natural antibiotic. If I had to give it a name, like, that's not for the record, that's just me helping you correlate things. But it's also preventative, and you can diffuse it, you can put it on topically. If there's a bug going around and you don't want your family to catch it, I really would lather on the On Guard and diffuse that and clean with it. Correct-X is like a Neosporin, a natural Neosporin, great for cuts and bruises, or cuts and scrapes and things you would use like Neosporin for. The On Guard hand sanitizer, so it's a hand spray with this blend in it. Breathe, which is great for all things upper respiratory. As they get a little older, you can diffuse in their room. You can put it on topically. This is what I was saying, like, not to use it on their chest or their back until after 2, but once they're 2, you can start using this. doTERRA also makes an On Guard breathe stick, which is similar to like a Vicks Vapor Rub. So it's a stick with On Guard blend, and yeah, like rub it on their bottom of their feet. And what's in Breathe is eucalyptus, peppermint, melaleuca, lemon, cardamom, and Ravinsero, which we don't sell that one separately. Great, great, great blend. A lot of people swear by that. Digestin is another one that I always have in my toolbox, and this is a blend for digestive GI discomfort. So it's kind of like your Pepto-Bismol for constipation, gas, diarrhea, upset stomach. So love that one. I've used this one a lot on the bottom of my kids' feet, and there's been times when they're completely constipated and I use this and they have a bowel movement. So amazing stuff. All right, and I thought this was a cute picture of a little kit you could give a soon-to-be mom for a baby shower gift, including a little bit of samples and like, this is the way you can use them. And then these are some of my resources. So like I said, great book to use. You can also get this handout that I had mentioned. It's a PDF, and I would love to send it to anyone that's interested to have on hand. But yeah, that's pretty much all I have. So if anyone has any questions, I would love to answer anything. If there's any samples that you would like, let me know. If you are interested in ordering because you've been learning about essential oils for a while and there's certain things you know you want to try, please reach out to me. I can help you find the best options for you, whether it's a single item or a kit. I can help you get the best deal for them and really continue to educate you along your journey. So thank you for tuning in, and I hope you guys all have a great night. Bye-bye.